as we talk, as we get started on our new series, Aligning Funding Opportunities and Initiatives in California. Today, we're going to talk about the American Rescue Plan and making use of those one-time funds for long-term gains for children, families, and communities. So, just as a reminder, here are some key functions of Zoom on your control panel, which may appear either on the top of or bottom of your screen. The little microphone, you can unmute yourself or mute yourself. We'll have some opportunities for some discussion today, so you may be utilizing that. You'll also see the stop video, so it looks like a little video camera. And if you want to share your camera and show us your beautiful face, we'd love to see it. If you don't feel like doing that today, that's okay as well. You can always turn that off. If you need to chat with us for any reason, or also we will be doing some interactive discussion and you want to use the chat, you'll just click on that chat icon. And also we have the reactions, which are always fun. So if there's something you hear that resonates with you, you can always use a little thumbs up or little clapping hands. So please feel free to use those as well. So just as a reminder, strategies, today our webinar, I almost forgot to mention, is brought to you today by Strategies Technical Assistance and the Office of Child Abuse Prevention. Strategies Technical Assistance provides technical assistance support to counties that are doing child abuse prevention planning. And our work is really grounded in these values that I just kind of wanted to share with you all. The first one is equity. We're really grounded in these values, so they're very important to us. Equity, community voice, strength-based approach, accountability, and collaboration. And we use these to make sure that, we're able to provide an equitable lens to the work that we do and also for our partners. We are also advocates of community voice, accountability, collaboration, and a strength-based approach. So today, this is the team that will be here to support you and also facilitate this webinar. My name is Lydia Marquez. I'm a Senior Technical Assistant Specialist with Strategies. Anvi Din is our amazing events coordinator, and she will be here to provide technical support for us. And of course, our fearless leaders who help us do this work every day and help guide it, Sarah Lacroix and Michael Williams. So you'll be hearing from both of them as well today. And I'll have Sarah tell us a little bit about our new Learning Exchange cohort.
Hi everyone, good afternoon. So glad you could join us today. So just briefly, I wanted to highlight that kind of jumping off of this first webinar will be a new Learning Exchange cohort that will be happening primarily in the fall and possibly also into the early parts of next year and could continue depending on folks' interest. So that new cohort is around aligning funding and also various initiatives that are happening in California. As I'm sure many of you know, there's a lot of funding coming down right now. There's a lot of new things happening, and we already have some exciting and existing things happening in our child abuse prevention and family strengthening field. So what we really want to do is have an opportunity to talk together, share together. We think of this sort of as a practice space for people to say, this is how we're envisioning collaborating with our various programs we have or various funding streams that are coming. This is how we imagine braiding it or getting ideas from others. So I wanted to share that we'll have our first Learning Exchange cohort session connected to this webinar on October 27th, and that'll be from 11 a.m. to 12 p.m. Pacific time. And that's also our presenter today, Marlo Nash, is going to be with us in that first session. So it's also an opportunity to go deeper with the material, to have a kind of intimate discussion with our presenter, our subject matter expert. So please feel free to, we'll provide a link so you can RSVP for that if you'd like to, and we hope you'll be able to join us.
Great, thank you, Sarah. And now we will have Michael Williams introduce our presenter, Marlo Nash.
I'll be quick because we really want to hear Marlo. But I'm very excited to introduce Marlo Nash. Earlier this year, we were reaching out to colleagues, and at Paces Connection, we got connected to Marlo. Marlo is with the campaign for trauma-informed policy and practice. And in preparing for this, as well as the California Family Resource Association webinar Marlo did for us and the presentation she did at our statewide summit, it's an education just talking and doing the planning meeting. And Marlo is continuing this long conversation that is really helping us think strategically about all the funding that's coming down. Today's focus on ARPA, but you'll hear a real strategic approach to other one-time funding. It's coming down. It's coming down from a lot of places. And so I'm very excited to introduce Marlo Nash.
Thank you so much, Michael and Sarah and Lydia. It's been a pleasure to work with you all to plan for today. So I'm very much looking forward to diving into the content. And just as by way of getting us started, I want to invite folks to chat your questions whenever you have them, and then we will have time set aside for answering questions, but feel free to chat them as you go. So I'm going to share my screen now to get us started. Is it sharing in full screen mode at this point? It's showing me a different view than I had when I tested it a moment ago.
It looks like we're looking at your computer screen.
You're seeing my whole navigation bar.
Yeah.
Okay, I'm sorry for that. I'm not quite sure why it's doing that.
Because it's always something.
Yeah, yes, you all can attest to that. We tested this before.
It's Mercury retrograde.
I guess so. Oh, goodness.
We can see the whole slide though.
I'm trying to think though, the best way to fix this quickly, because the problem is, okay, I very much apologize. We did troubleshoot all this and I thought we were ready to go. Let me just try one thing here, see if I can change it and fix it. I think I did. Oh, I see what's happening when I leave it. All right, you're gonna have to see some inner workings here for me to get this to work right. My apologies. But I think.
No worries. Maybe while we have Marlo pull up the presentation, are there any, initial questions that folks might have about the Learning Exchange cohort that we're launching at the end of October, or any things that you're hoping might be covered in the webinar today? You're welcome to come off of mute or also put it in the chat. All right, looks like Marlo, you're up and ready to go.
Yeah, and we're going to ask that question again in a minute. So thanks, Sarah, for vamping for a minute while I got that fixed. So I'm very excited to be here with you to talk about the American Rescue Plan funds. It's a multi-dimensional topic, so we're going to dive in and hopefully there will be some insights I share with you, but I'm sure I will learn from you all as well. So to give you a quick walkthrough of what we're going to do, we're going to take a few minutes to just overview the session and do a quick check-in in a minute, where we'll ask you to check in by chat to some questions we have. We'll do some context setting to talk about some of the conditions that we know we're all living within, but some of the research and things that are happening, some of the data that tells us really almost up to the minute how things are going for families in California, and then just a general background about the American Rescue Plan Fund, just to make sure everyone has a baseline of information. And then we're going to do some exploration of something. I'll put some things out for you to consider, and I have some recommendations for you to consider. We will have time for you to break into small groups, because it's going to be, by design, it's going to be a lot of information today, a lot of ideas for you to put in your brain and kind of roll around. And so when I do this kind of webinar, I like to give time for folks to go away in smaller groups and kind of process together what you've heard. Then we'll come back and probably we'll only do a quick, not a full report out, but just a quick check-in into some of the things that you covered when you were in those Zoom room breakouts. And then we're going to ask each person, as a heads up, we're going to ask each person as part of our checkout to identify one next step you plan to take as a result of today's webinar. So you can kind of be listening for what you think your immediate next step will be. But as I said, by design, today's webinar is intended to put lots of information out there because of the learning exchange that's coming up in a couple of weeks that Sarah spoke about. We want to fill your brain today, give you lots of things to think about, and hopefully then come back for that learning exchange where we can dive deep into what your questions are or your ideas and things like that. So the purpose of today is to share insight and information on the impact of community disruptions, COVID-19, but as we all know, we have a pandemic of racism in the country, and natural and environmental disasters are certainly disruptive to our lives and the children and families that you all serve. Today really will come through the frame of the COVID-19 pandemic because it's largely centered on the American Rescue Plan, which is obviously the recovery dollars for the pandemic. But I just want to acknowledge that these other pandemics and community disruptions are also happening in the time of the COVID-19 pandemic. We'll review the American Rescue Plan Act at a high level and some of its relevant provisions for the work that you all do. Explore possibilities for immediate recovery, pandemic recovery, and long-term gains out of decisions that can be made now with these resources, and sets the stage for the upcoming learning exchange, which is on October 27th, but I noticed that I have a different time in my slide than Sarah, you spoke about earlier, so I don't want to confuse people, but it is on the 27th, and we'll get information out with the exact time. So out of today, the results we expect is that you'll have an increased awareness of funding and opportunities available through the American Rescue Plan Act, that you'll have knowledge that you can use to more fully maximize the use of rescue plan funds. You'll have some starting points for planning to sustain structural changes and gains. So again, that's seeding your thinking about where could you go from today to either build on things you've already been working on relative to the American Rescue Plan Act and to pandemic recovery, or to give you new pathways forward. We want to identify your questions, answer some today, but as I told Sarah and Lydia as we were preparing for this, if I am not 100% confident in an answer to your question today, we're going to hold on to it and come back to it at the learning exchange. But I will answer the ones we have time to get to and that I know that I have the answer for. But part of the complexity about the American Rescue Plan, it's a kind of a once in a lifetime opportunity to have this much money, and the amount of flexibility the federal government gave to states and localities to spend it. But it makes it hard it's not like other situations where you can say, well, what's another state doing, or what's another community doing, because everybody's pretty much on the same timetable. So there are some developments, but a lot of it, we're all in the whole country, we're all kind of learning this and strategizing in real time together. And then our fifth result, as I already alluded to, we want to make sure we hear what one next step you're going to take today as a result of the session. So now we'll do a quick check-in. If you could just share in the chat your name and your community and county, and then on a scale of 1 to 10, with 10 being the best, how are you feeling and doing this October compared to October 2020? So that's just your name, your location, a number between 1 to 10, and then what's one question you bring to today's session, or one aspect of this topic you would like to see addressed. So I know that's several bits of information from you, so we'll give you a minute. I'm gonna make it so I can see the chat. I'm going to try to look at these as you put them in and absorb, but Lydia is also being a second set of eyes on these for me so that we can make sure we're being responsive to the things that are top of mind for you. So just encourage you to begin chatting in. Yeah, I already see the item that was in there from Nina, and I'll kind of address some as they come in. And I think that's, we'll talk about this more, but I think it's exactly right that that the government level staff, the public agency staff, has a concern about these little bits of these funds going out in small amounts, because they then are accountable for reporting on all the different things. So it strategically, that suggests that if there's a way to sort of package something as one big project that maybe flows through one nonprofit agency as an intermediary, that's maybe a strategic way to go. And I will also talk about this, that having a framework for your request and having shared alignment across many partners for a request helps with all of that. So it's not, a request for one program here and one program there and one nonprofit there, and kind of a whole bunch of different requests. But what we're hearing from some of the public leaders that are decision makers over this money is, if groups can come with a framework that really shows how will this money spent add up to the kind of outcomes we need for children and families, so that when they spend it, they're doing it with confidence that it's going to get valuable outcomes. So I'm seeing it's great to meet you all through the chat, and I see I gave you so many questions. It took everybody a minute to type that in, but okay, I'm just scrolling through.
So we got a lot of good numbers here, a lot of 8s, a few 6s and 7s, but mostly a lot of 8s, which is great.
Yeah, good. Isn't it interesting? I asked this question in a lot of webinars, and it's always interesting to me how people can answer independently, but you can kind of quickly see a trend. So I hope those of you who might still be typing will just go ahead and finish up what you're typing and send that when you have it. And I will say just a bit of commentary. The scale of 1 to 10 question I borrowed from a now friend. We've met and started working together during the pandemic. She does trauma-informed work for infant and toddler, really, really early care networks in New Jersey. And she asks this question at the beginning of training courses that she's doing with early care professionals who are in direct contact with families, so child care providers, infant mental health specialists. And they are actually scoring that they're doing much worse on a scale of 1 to 10 this year versus last year, because they're very tired and they're really feeling the secondary trauma. So it's been interesting to me and to her, as we share this with groups that are not necessarily still on the front lines, the scores are higher, because generally we're feeling, like there's light at the end of the tunnel. We're going through, it's not over yet. We're promising a few months with the vaccines and, and other information. I heard the other day that they've identified sort of the Tamiflu equivalent for COVID, which will help, we've got a lot of positive information, and yet the people who are really closest to children and families on a day-to-day basis are just exhausted and worn out and really feeling the effects. So it's important for all of us to keep that in mind, and hopefully I share it with you because for me, it continues to energize me to do this outcome-focused work and to think about trauma and to think about equity and to think about sustainable change, because I know there are people out there who really need us to be thinking about that and advocating to get resources to them. So now we'll go through some of the contextual information. So I talk about the pandemic as a population level traumatic event. So I want to start there. I know there's a lot on this slide, but I want to start there in that left-hand column, because it is unusual to have a single event across our entire country that everyone is experiencing. And researchers in the field of trauma science explain it as, there is a traumatic event, and then there's how someone experiences it, and then there is how it affects them. So just like the scale of 1 to 10 exercise I was just talking about, we've all had this population level traumatic event, but it affects us in different ways and at different depths. So I think it's really important to acknowledge that out of this time, becoming truly trauma informed across all of our systems is really a critical need. And I emphasize that as when Michael introduced me, he let you know I'm connected to the Campaign for Trauma-Informed Policy and Practice. So obviously I advocate for this all the time, but I see it, and you probably see it as well. But I think it's important because a lot of times decision makers over funding, like those who are decision makers over the American Rescue Plan, may not be the kind of people who have really experienced this pandemic as a serious trauma. Maybe we've all had disruptions in our lives, but if they haven't, had something that really shook their foundation, then they may not recognize that other people are really having severe traumatic effects from the pandemic. So in terms of being an advocate, it's a part of the narrative you really need to be thinking about lifting up and helping people understand. Oh, I did not mean to do that. Sorry about that. So I'm going to go around these circles, starting with the one at the top, to share with you. And this is one of the most unsettling things that I have come across in studying the context of what the pandemic has caused. And this is information that's going to come out in the next few weeks as a peer-reviewed journal article in JAMA Pediatrics. It's in preprint right now. But there is a group of researchers, 5 universities, who have a 10-year data set on infant development, cognitive, verbal, motor development, and they use MRI technology to do brain scans, and then they also do an interactive assessment. And the 10 years of data basically shows them that infants pretty much always are about the same. There's some, if they plot their cognitive and verbal and motor ability, it all sort of has, an average amount area that it lands in. And what happened when they started giving this very same testing instrument and using their same protocols with infants born during the pandemic is that they noticed that there's a significant drop in IQ. And it's a significant drop below the low end of normal. And so further, what they're seeing is as they go back and follow up with these infants, it is actually getting worse for them. And so what was a cognitive issue initially is now become a brain structural issue. And it's very, very alarming because, as you all, I'm sure, are familiar with infant brain development, that for the first 1,000 days, there's a lot that can be done to help an infant have healthy brain development or to rebuild or mitigate against traumas or disruptions to brain development. And that time is kind of, we're almost at 1,000 days for those children that were very first born in March. So the rescue plan money is what is available to get access the most quickly now to address this, which is a situation that needs to be addressed as quickly as possible. So this contextual point alone is hopefully helping you understand the real importance of people like you who know these populations, who know the neuroscience and the trauma science and the ACEs research, to get very vocal about needing to direct resources toward families, in this case with young children. Then if we move to the next bubble to the right, you've probably heard there is a COVID slide in education for students, K through 12 students. And so that is a concern. And we know that there's efforts to try to address that, but we are still experiencing the pandemic. And so that is a challenge that is part of our environment right now. Behavioral and mental health issues. We've got data that shows that the levels of anxiety and depression continue to be high, and that substance use disorders are up. And we know that those also are very disruptive to households and families. There are relational workforce issues. There's workforce shortages. I'm sure you've heard about that. You may have experienced the pain of that yourselves and your communities. and also secondary trauma, as I was speaking to earlier, that folks who do relational health work in human services, work directly with families and children, this has just been very depleting to them. And so it's very hard. And then especially with issues of pay and compensation and all of that. So that's part of our context. The multi-generational impact, we know is already there if we can't mitigate it, just because if you back up through the circles, the infant IQ becomes a multi-generational issue. The COVID slide can become a multi-generational issue, because as it causes people to have trouble with learning or change the course of their education, all of those things just change the course of life for folks, which will affect the children, their children in the future. And so all of this really adds up to the pandemic is an ACE. It is an adverse childhood experience. It has created an adverse community environment. And so that's what we're dealing with in all the same ways that you think about how ACEs have an immediate and long-term, lifelong impact. The pandemic has become that. So I think we're going to do a couple of poll questions now. Lydia's going to, I need to stop sharing, correct, Lydia? So that okay, let's hope that doesn't disrupt my view when we come back in a minute. So first, we just want to, we're going to do several poll questions today, and I'll read this one out so you can be answering it while I'm talking. But do you consider your organization to be trauma informed? Yes, no, or you're getting there. What we're doing with the poll questions today is getting information that will help me immediately today try to emphasize the information that seems like it will be most helpful, and not spend time covering things that you all are well versed in. But it's also helping us have information again for that learning exchange in a couple of weeks. Things we can learn from you today will help us know maybe how to prepare to spend time at that. So Lydia, I'll follow your lead about how long you want to leave the poll up and how we'll see the results.
So it looks like we had everyone answer, and let me show the results with everyone. So it looks like lots of you are getting there.
Okay, but and nobody is not at least on the path. So that is really great, because for your organizations to be trauma informed is important in the role and position you have in the community to then really be modeling how an organization becomes trauma informed, but also being a credible advocate for being trauma informed. So for those of you who are there, congratulations. For those of you getting there, thank you for being on the path. It's an important part of this work at this time. And then our next question is about ACEs. Yeah, so what is your level of familiarity with ACEs? Not familiar, somewhat familiar, very familiar, or I train or I could train others on the topic. So we just, again, I'm going to touch on ACEs a little bit further, even than what I did a moment ago. And we just want to see, get a sense of how much time to spend on that today, based on what you know. So again, Lydia, I'll just. Okay, so
you all have quick fingers. So
I think for today's discussion, even those of you who are somewhat familiar, that helps me know we don't need to do a deep dive into that today, because I think for the purposes I'm using ACEs information today is really to set the stage for the considerations and recommendations that we'll be talking about later. So thank you for sharing that. And then what is your level of familiarity with the pair of ACEs concept? Not familiar, somewhat familiar, very familiar, or I train or could train on this topic. And I want to, while people are responding, thank you for being engaged and for responding and helping us. Okay, not familiar. Okay. Okay, so we have a little bit more of a mix there. So I think that was our last poll question for now, right, Lydia? Okay, so we'll swap screens. Here we go again. I'm not sure how to avoid what's happening. I apologize for this. Okay. So the pair of ACEs is really just saying there are adverse childhood experiences that many of them happen with inside the kind of family bubble, not all of them, but certainly they all impact the family unit. And you see those at the top of this image of the tree with the roots. So maternal depression, abuse of a number of different kinds, substance abuse, domestic violence, homelessness, incarceration, mental illness, divorce. But there are also adverse community environments. So poverty is certainly, and you see those at the bottom of the screen. So it's another kind of ACE, and another way to think about ACE is that it's the environment that we live within that also has immediate and lifelong effects on health and well-being. So the pandemic really falls in that. If you see the phrase community disruption, that can mean a lot of different things, but certainly pandemic, natural disasters fall within that. Discrimination certainly references the pandemic of racism, housing, lack of economic opportunity and mobility, and community violence. So I want to put this out as the context today because one of the things that is important about the American Rescue Plan Act is that it in effect acknowledges that there are these adversities in childhood in the way that we understand them that are at the top of this graphic. But it also recognizes that there are adverse community environments and that the kinds of ways you help families aren't always directly inside that family bubble, changing the conditions or the roots of the soil that the families are in. If you think about this tree graphic as kind of a metaphor, visual metaphor, that you need to change that in order to really help have family and child good health and well-being. So when we think about that then, and then we look at the data. So this is census pulse data that is very recent. So this bit of data that you are seeing now represents information that was gathered August 18th through September 13th of 2021. So very, very recently. And so I just wanted you to see what it kind of looks like. And it was interesting. I looked up a number of different pieces of data to show you. And I thought that it came up a number of times that roughly in the 40% range, which is a lot of people dealing with really serious issues. So 40% unemployed in the past week, and knowing that this is just last month, this data was gathered. 41% very likely or extremely likely to be evicted in the next 2 months. Slightly lower percentage to be foreclosed on in the next 2 months, but you can see that this this line graphic, the trend line, covers both of those. And so these are trend lines, and this data, I know that the print is small, but the trend line that you're seeing started back in February, March of 2021. So this is kind of a close-in look at how things are going. So if things are trending a little bit upward, you know, in just a short amount of time, things have gotten better. But as you can see, they've mostly stayed the same, or some are even trending downward. The 43% are not eating enough because of the cost of food. And then 44% are not receiving the child tax credit. And I put this one on here because I feel like there's an action to take around that. But it means that there's, and for some families, this could mean as much as $20,000 in this year of child tax credit that they may not be receiving yet. And so that's a significant bridge to build between that resource being available to all families with children and this many folks in California not accessing it even recently as last month. So that gives you a sense of kind of where you all are right now. And again, underscores the need for people like you who understand families in your communities and children and what they're living with to really be very actively and vocally advocating for them. So now we will cover just an overview of the American Rescue Plan Act. And I think before we kind of dig into some of the details, I just want to emphasize again what I said a moment ago. The real importance of the Rescue Plan Act, beyond the amount of dollars that are in it, is that it recognizes the two kinds of ACEs, really, adverse childhood experience and adverse community environments. And there's lots of flexibility that allows for addressing those adversities, which is just very unusual for there to be money that comes down in this large amount all at one time to be thinking across the need, or thinking holistically about the needs of families, and being able to be creative and strategic about how the dollars might go together to really address all of families' needs, and also to change how your community systems work going forward. So the rescue plan, it's been around for a few months. It passed in March. It offers different kinds of responses to the pandemic. So in some cases, it's direct relief, like the child tax credit, stimulus payments, childcare assistance for essential workers, healthcare, things that as long as people are known to the system, it's going to flow to them directly. There's not kind of any intervention that's needed, with the exception of the child tax credit. You see the asterisk there at the bottom of the slide. Those families whose income was so low they were not required to file taxes, they are eligible for the tax credit, but they are not known to the IRS. And so they have got to have support and connection to fill out a non-filers form, which will then make them eligible for the tax credit. So we'll talk more about that in a minute. I just want to emphasize that's a direct relief to lots of families, but not to the poorest families in our country. They need some extra help and outreach to know that this is available to them. Then the rescue plan offers programs that address issues. So addressing issues like housing, hunger, substance use disorder, childcare, unemployment. And I'll show you that how some of those funds are flowing in just a minute. And it represents historic financing wins. So the child tax credit is anticipated, it's already showing that for this year only, it's cutting child poverty in half. It was the largest one-time federal investment in childcare. It offered flexible funding to states, counties, and municipalities that can be used, as I said, to address essentially root causes of child maltreatment, or can do the kinds of things that we know build protective factors and improve systems response to families' needs. The funds flow in different ways and have different deadlines for expenditure, which is why rescue plan money can get kind of confusing to work with. Some of the money flowed federal to state, and then the state makes decisions. Some of it flowed to the state and to localities, which gives different level of decision-making authority. And some of it was federal directly to local communities, which gives another different kind of set of decision-making processes. So mostly you don't have to keep up with any of that, except to know that if you end up deciding to have a comprehensive plan, or maybe you're part of a coalition that's trying to have a comprehensive plan for meeting the diverse and needs of families in a holistic way, there are lots of different places to go for funding to do that. And then part of the context of the American Rescue Plan is that there are so many issues that need to be addressed that technical problems are going to be appealing to decision makers or policy makers to address. And but adaptive problems like human needs and the needs of the human services sector to meet those needs are harder to solve. And so there's a tendency, and I'm sure I'm not telling you anything you don't already know, but just sort of elevating for your thinking right now relative to the rescue plan. There's a tendency for decision makers to do the easy things and to do the things that can happen if they're elected official, do the things that will show returns within the period of time that they are in office. So there's a political overlay. So it makes it much more appealing to invest in capital projects, or, solve problems that they know they can sort of put a timeline and a price tag on. It's going to get taken care of, and they can check a box, and then they can say, look at this great thing that we did. And the thing is because the needs are so high, those are not even bad things necessarily that they would spend money on to address technical problems. But it takes people like you to really help them understand the more complicated problems, the relational workforce shortage, what's behind that. The information I shared with you earlier about infants born during the pandemic. They've got to hear that. They've got to have people like you help them understand it and give them ideas for how to spend money that's really going to truly recover those and address those problems and recover the community and the families and the children from the issues they're experiencing. But they're much harder to communicate. They're much harder to convince people to spend money on. They're much harder to measure when the money has made a difference. So there's a lot of challenges in doing that, but nevertheless, it's got to be done. So this is not an exhaustive list of all the money that's coming to California, but just to give you a sense. So there's a large amount of money that's going to states and every single county. So your state got $27 billion. Every single county got money. Alpine County got the lowest amount at $219,000. LA County got the highest amount at $2 billion. And then approximately 90 of your metropolitan areas in California got money, and ranging from the low end of $2.7 million in Paradise to the high end of $1.3 billion in Los Angeles. And then non-entitlement units are communities that are 50,000 in population or less. And there was 1.2 billion allocated in California to be distributed to those non-entitlement NEUs, they're called, those small communities. And then nationally, tribal governments have access to $20 billion. I can't give you the breakdown for that because the feds are keeping that information confidential, but tribes are also have access. So this is a single pot of money that's given out in these ways that I just described to different levels of government. The important thing to know about them is, first of all, they all come under the same federal guidance. So that means the same things are allowable for all of these funds. And that's important because what it means is you could say the state is putting money towards something like home visiting, and you know that this money you're going to get from the state for home visiting is not going to meet the need in your community. You could go to the county and say, we know we have this many more families who need home visiting than this state amount of money will fund. Will you put this much county money to match the state money, and we can serve more families? And then even you could go to the municipalities that have received funding and say the same. So you can stack or braid money from those different levels of government. So that's one kind of potential strategy for you to be thinking about. The other thing that's very significant is that this is the pot of money where they said you can use this money to address issues that have been caused by the pandemic or issues that have been exacerbated by the pandemic. So if you think back to that pair of ACEs, it's issues that, any of those issues in the adverse community experiences or environments or adverse childhood experiences, this money, you could make a case for spending this money on. So there's a lot of flexibility there, which means you all, can think about what's our plan, what's our proposal to really address the needs. And maybe they are needs you've seen for a long time in your community. This is an opportunity to address them. So childcare in your state got $3.9 billion. Education got $34.9 billion. And I'm going to go back and talk about that a little bit more in a minute. Community-based child abuse prevention, which I think, as I understand it, you all are recipients of those funds, received $29 million. Now, it's exciting because that's the largest amount the CBCAP program has received. But I want you to look at that in context to the amounts of money that are going to these other systems and kind of other issues. And just want to make sure and impress upon you, it's for you all in the work that you do. It's not just that CBCAP money that could come your way to help the families that you are in place to help and support and strengthen. It's these other monies as well you need to be thinking about. So housing and housing related, you've got approximately $4.4 billion in the state. It might actually be more than that. Housing is it's a complex area. There was lots of money that went to housing. That's why I put approximately, because it wasn't like one big pot of money. It's lots of different programs they sent it out. So it's a little harder to see all the money, but it's a lot. Mental health and substance use block grants got a supplemental of $395 million. That's a state level. Your state had to turn in a plan this summer for both of those block grants. I don't know if they've made that information accessible yet, publicly accessible, what they decided to spend that supplemental funding on, but it would be something that would be helpful for you to know and interesting for you to know, because it's another way that you might be able to say, look, the state is going to spend this money, and if we stack this local money with it, we can serve more families, for example. And then community mobile crisis intervention services through the American Rescue Plan have an 85% enhanced federal match rate, which means the feds are going to pay for 85% of a mobile crisis intervention service, and the remaining 15% has to be picked up in the state. So it's not a funding stream necessarily, but it is an important service that could be in your community. And I think the main thing for people like you to think about, one, is to kind of keep your ears perked up. Are more community mobile crisis intervention services coming to your community as a result of Rescue Plan? And are they informed by what you know about your population? So what I've learned about this is that a lot of times, for example, these folks aren't trained in how do you address a youth, like a call about something that's going on with a youth, a teenager, for example. They aren't necessarily trained in being trauma informed based on adolescent development, if younger children are involved, they're not necessarily trained on that developmental, that family unit kind of the cultural things you may know about your community. So the role there for you might be to partner with them and really help them understand your population that you work with, and how those when those mobile crisis services are activated, how they can be the most responsive to what you know about your community. So now we'll move on to potential barriers for the American Rescue Plan. Some of these I've already referenced, but this is not to discourage you, but to just point out there are some things, it's complex. I already talked about this. There's this bias. You can anticipate a bias to finite concrete capital infrastructure projects. A reticence to add people because it's one-time money, and so when it runs out, so if you've hired people with this money, in a few years it's going to run out, and so this may or may not encounter these barriers, but these are some of the things I've heard in the work that I've been doing around the country. So they want to say, don't add additional infant mental health specialists, for example. Don't add additional home visitors, because they won't have jobs when the rescue plan money ends. And I think that there's an argument to be made against that concern, and we'll talk about that in a minute. This came up in the chat. There's an inclination to have a small number of larger projects. So strategically, it's important for you to think probably not just what can my agency get for the work that we do, but to be the leader of putting forth or join a group that's putting forth a larger, more comprehensive plan that, again, maybe is asking for one amount of money, but to accomplish several things. And then it becomes the intermediary who gets the one pot of money. It's their responsibility to track, evaluate, and then report to the government entity. So it sort of offloads from the government entity having to track a lot of small projects. I already talked about this. Human needs are complicated to resolve. There is a tendency, could be a tendency to just doing band-aids, so doing things that aren't actually going to make that much of a difference, but they can do it, spend the money, and it's done. So this sort of short-term kind of thinking. Insufficient knowledge of the long-term effects of a population level trauma is absolutely where your knowledge of ACEs comes in and needs to be elevated to decision makers to help them understand how this could end up being lifelong and how it could end up being multi-generational. And as you know, then it means very costly just in terms of human cost, but also very costly to systems. Another challenge is the pandemic is not over yet. So there's this rescue plan money, and now we find we're still in response and relief and recovery phases all at one time. And I know many of you have experienced a disaster of one kind or another, and usually you move through those things in stages because the disaster has happened. You'd have the immediate response, which is literally, you know, the police and ambulance and firefighter, you know, those who go on the scene as first responders. Then you have relief of just making sure people have housing and clothing and food and the things they need until they can recover. But in the pandemic, we're still in all three of those phases. So it gets very hard to, you know, it's hard to argue against spending money to respond to immediate needs when you're looking at long-term problems, but you've got everybody, not just you all, but everybody during this time has kind of got to be able to hold those three realities at once and then make decisions that are going to be are going to have the right level of impact. It's one-time money, and so you'll get questions about sustainability, which we'll talk about in a minute. And I have this question: what else have you encountered, or do you anticipate this? Welcome you to chat now if you have things on your mind. This is something we can go delve more deeply in during the learning exchange in a couple of weeks, because it'll be helpful for your colleagues to hear if you've already started having these conversations, or you're already actively working, or maybe you've successfully secured some of the rescue plan money. What did you encounter, and what kinds of things are you concerned about? So now this is where we're going to go through and just give you a lot to think about. Is again to hopefully, you know, give you some actionable ideas to leave today from, but also to kind of think about and prepare to come back with questions in a couple of weeks. So considerations and recommendations. So first of all, and I've referred to this a couple of times already, but one consideration that you have right now, if you don't already have for your community, whether your organization is the leader of it, kind of the backbone of it, or another organization that you're a coalition that you're a part of. But just this concept of it's time that we have systems of child and family well-being, that we know we've got to build well-being from the beginning, that we make sure that every family has educational opportunities, employment that pays a living wage and offers benefits, financial stability, care when they need it for the child care for their younger children, or elder care for their older children, all the things that every family needs and wants. And then, but that we have to have that, and we also have to have secondary prevention, which restores safety and well-being when there's been a disruption, when families are maybe have lost some of those building blocks, whether it's because of a disaster or a mental illness or a death, and those kinds of things that we know happen to families that can cause those building blocks to crumble, job loss included. Then there's tertiary prevention. So when the adversities they're experiencing become so overwhelming that they end up being involved in the child welfare system, and you've got to rebuild that safety and well-being. And then stabilization and permanency, where they're along the continuum, there has to be intervention to keep the children safe, and to work on reuniting with their family, hopefully, or getting them with an adoptive family or a kin caregivers for their stability going forward. So this is, when I say system of child and family well-being, this is, you know, at a high level, a representation of that, but also thinking about all those building blocks. So not just parent skill building, but also housing, financial stability, employment, all of those things. And this, again, as I said earlier, the American Rescue Plan gives a lot of opportunities, but, and as you know, those opportunities don't typically flow that way. So usually it's a block grant for one thing and a grant for another thing, and you know, and there's all these restrictions on how you can spend the money. Well, that's, I mean, there are guidelines for the American Rescue Plan, but it offers so much more flexibility to work across systems than is typical. So this is from Aspen Ascend. This is their 2-generation work. You may be very familiar with this, but it's just, I wanted to put it in here just to show this. These are the components of a system of child and family well-being, where you're thinking about holistically about what children and families need. So, so that first consideration was all about think expansively, think holistically, think about the kinds of things that maybe you don't normally work on, but you know that are issues for your families. Like I have found housing is one frequently in the other some of the other communities and states where I'm working, where the folks who work on family and child well-being really know that housing is an issue, but really haven't made relationships with the housing community, doesn't really know that space. But now there's all this rescue plan money coming in, and the housing folks need to understand what are the distinct needs of children and families? What are you seeing? Because otherwise they don't necessarily know how to spend that housing money in the best ways possible. And I'll give you an example. There's research now that shows that home visiting paired with concrete support, specifically to include supportive housing or housing first models you may be familiar with, that dramatically decreases the likelihood that a family will end up involved in the child welfare system. So if you're going to offer home visiting, do you have a robust housing component worked out with your housing leaders in your community? That's the kind of thing that I'm talking about. So cross collaboration at community level. So going back to the different funds, I'm just going to quickly flow through this. The treasury funds, like I said, all of the levels of government following the same federal guidance. The funds can be stacked and braided or aligned, whichever term you like. The treasury funds can also be used as glue among other funds. And this is the kind of money you don't normally have to be able to say, oh gosh, this program could be connected with this program if the funding stream would just allow it. Well, the treasury fund money has that flexibility if you could make the case for we need to bridge these resources together. The elementary and secondary emergency relief funds, quite a bit of money. I showed you the figure earlier, went to school districts. The school districts and their guidance, they are required to demonstrate that they're having meaningful consultation with stakeholders, and you all are stakeholders for them for sure. So if they've not consulted with you all, it would be good to be in conversation with your local school district to find out how they're using the money and if they've got any money left to spend, if they're still trying to make those decisions. Larger school districts may be all over this. They've got more staff. They have just more capacity to think through and plan. Much smaller school districts may actually be struggling to figure out how to spend the money. So it depends on where you are in the state and what your situation is as to how much they may have already committed the dollars, but it's definitely worth being in conversation if you haven't been already. The dollars can be used to address the mental health needs of students, and there's lots of flexibility in that money. For example, they can spend that education money to reach children birth to 6 years. They can offer a community school model. So there's lots that can be done that might not typically be able to be done with money that's flowing to the school district. So it's important to keep in mind. The Child Care Development Block Grant and Child Care Stabilization Fund. The Child Care Stabilization Fund is sending money out. The state has to grant that money, 90% of that federal money, directly to providers. So that means your providers, your child care providers in communities, in your communities may be getting a decent amount of money to really help address the needs they have, but they may need partnership as well, because they've got a lot on their plates. And so it might be another place where it's a good time to think about, you know, is there something you could do in support of them or with them, or could you bring together a cohort of providers to have some sort of shared like training opportunity, or substitute pool, or, you know, different kinds of things that could be done. But it's provider by provider by provider in this case, because the grants go out to the providers. And then the Community Mobile Crisis Service, as I talked a little bit about that earlier, that they have to be trauma informed. So they are part, if you have this in your community, and they're receiving rescue plan funds, they have to be trauma informed, so they could potentially be partners in making all the systems in your community trauma informed. Another consideration is to communicate and support. So engaging family voices, and I saw that's one of your values at the top of this webinar, so I was happy to see that. But talk to, you know, be in touch with your families. What are their needs, and would they tell their stories and help advocate for resources? And then find and support non-filers to access the child tax credit. And that is not going to be just have a billboard or do a PSA, or, you know, that means, you know, actively doing a factor analysis. Who are these folks in our communities? How might we find them? And what's going to really support them in accessing that tax credit? Maybe they have to, you know, have someone sit with them and fill out the form, or someone really talk them through and help them trust that they will get this money if they make themselves known to the IRS. So lots of complexity there, but definitely a need to get that money to families. Ensure families know about healthcare coverage options. So there's a lot that was in the American Rescue Plan to help families cover the cost of healthcare, particularly if they've lost a job, they're not Medicaid eligible, they lost their job, lost their coverage. There are significant financial supports to helping them get money coverage through the healthcare exchange. If services, so if you're successful expanding services by working with all these different decision makers to bring rescue plan money to your community, then you need to think about how you're going to reach families to let them know all those new resources are there. And then kind of related to that, but a general point is that when you are considering communications and outreach strategies that are targeted to the distinct needs of particular populations, it's important for you to think about who are their trusted sources, who will they listen to, and how do you reach someone who's overwhelmed or traumatized. So again, it's easy to think, oh, we'll do a campaign, we'll have billboards, we'll have pamphlets, you know, we'll buy Facebook ads, whatever. But there's a different level of reaching someone who's dealing with or is trying to recover from the effects of a traumatic event. You've got to reach them in different ways and really think about how can you really help them, because a lot of times people in that situation, there are resources available to them that they just don't access because it's just overwhelming to even think about trying to access it. So telling them about it is not enough. There's more of a strategy needed there.
I think we had a poll, Marlo. I don't know.
Oh, yes, thank you. Thank you. That's right. So I will stop sharing and let you run the poll. And actually, Lydia, would you be able to read that poll out? Because I'm going to try to set up again so that we don't have the problem we've been having when I come back to share my slides.
Sure. So our next question is, are you already working with your county government to plan for spending pandemic relief funding? And the answers are yes, no, or trying. And so let me go ahead and get us all loaded up with this, and I'll launch this. And y'all are so quick on the on the polls. And while we're waiting, I don't know, Michael, if you had a question or.
A little bit more of a pipe in with kind of Marlo, a couple slides back, talking about all of the cross connection possibilities for the funds. I wanted to mention a few strategies connections. One being the Community Schools Fund, and we'll be having a webinar on that coming up in December, and as well as homelessness prevention funds. And I know Elena Fiallo from Population Change Institute is involved with that. And we'll have a webinar on that coming up in November, and I'm sure we'll have the details on that. And then I also wanted to note a couple things in terms of, you talked about having a comprehensive plan, and in California, the Family First Prevention Services Act is coming out, and but there's also state matching funds, and my OCAP colleagues on the call can probably correct me if I'm wrong. I believe it's Assembly Bill 153 that requires a comprehensive prevention plan. And our conversations with counties is often around how can we make it truly comprehensive? And our prevention planning has been, that we've been doing with them, we see as that comprehensive plan, because it could be easy to say, well, make it just comprehensive enough to get the Family First funds, as opposed to put Family First in the context of a plan that will really move the needle on child abuse prevention. So those are my 2 points. And I have one last one in terms of the child tax credit. Folks should sign up for the California Family Resource Association newsletter. We are starting a partnership with Packard Foundation to work with family resource centers to do exactly that outreach to families around the child tax credit. So I want to pop in those 3 things.
That's all great. I'm really glad you shared all that. And actually those 2 slides that I showed about a system of child and family well-being, I do talk sometimes about on the Family First Prevention Services Act. And those are 2 slides I show for the very reason that you said, like, you could implement Family First, or you can use Family First as sort of an energy center to say, now, we're going to implement this broader child and family well-being system. And, it can be very effective. I'm doing some of that work in other states as a consultant. So I'm glad you mentioned that. So we've got the results, and some of you are already working with your local levels of government. Some of you are not at all. So I would hoping you're getting ideas for doing that out of this. And some of you are trying, and again, hoping you're getting ideas because there's a mix of needing to have the strategies and needing to have the narrative and needing to have the data and the research. And so there's a way to put all of this together. And that's what we'll talk more about. I'm gonna move along. Can I share? We swap sharing?
Sure, here we go.
Okay. Hopefully I have done what I need to do to be able to. Oh gosh, no, it went back. Let's see if I can do this differently. I don't want to make you. Let's see. Here's where we were. Let's see if it's not going to let me do it. Is it? Okay. This is the view we're going to use because I don't want to waste your time thumbing through. And I apologize. This was not the way this was working earlier. So, leveraging existing resources. Interesting that you mentioned Family First, Michael, right before I put this slide up. But absolutely, everything Michael just said. This is a time to really think about Family First Prevention Services Act as a resource, but not just thinking about that, but thinking about how to bring the concepts that are in it, like being family-centered, focusing on substance use disorders from a family-centered lens, mental health issues from a family-centered lens, being trauma-informed, being equitable. Those are all concepts that that are in Family First Prevention Services Act, but certainly are useful for a whole continuum of child and family well-being. Safe baby court, family treatment court might be existing in your communities, and you may want to expand those, expanding early Head Start and Head Start and other proven models, programs, and approaches. You may have things that are very local to your community, but you have evidence to show that they get the outcomes that are needed during this time to help recover families from the pandemic. So that's another thing to lift up. There's a lot of flexibility to spend on local things, and again, that's not always the case for federal funding. A lot of times it comes out sort of categorically for a certain kind of program, but you have more flexibility now. So here are some ways you're going to need to think about how to sustain the changes that are made. So I'm just going to buzz through this because definitely we could talk a lot more about this. Gets into strategy and being, possibly being innovative, but certainly there could be reductions in cost of public systems if this money is invested well now. It could be the difference between your child welfare population growing or not, which is in and of itself is costly, but there are all the other public system. The issue with the infants who have a lower IQ, if that does not get addressed, there's going to be an enormous cost to your education system when those kids get to pre-K or kindergarten, because they're just going to have totally different kinds of support for their learning if their needs are not addressed on a different course, give different trajectories set for them based on what's happened to them because of the pandemic. So shifting people's mental models, and I'm just going to leave that there for now. Lots to talk about there, but having people think differently about how the money could be used, what the needs are, that kind of thing. Shifting systems culture. So again, how do people view families that live with adversity? Do they blame the parents? This is a time to say, you know what, it's these adverse community environments that are a big part of this, and the pandemic has brought that really illustrated that very vividly to us. So now let's think differently about how we meet the needs of these families and not just place all the blame and burden on the family bubble, but let's recognize as systems that there's different. Let's recognize that we need to be trauma informed at all times, but certainly in response to the pandemic. Recruiting stakeholders for advocacy. So if you get housing and adult behavioral health and education and all these stakeholders all in agreement around a comprehensive plan for what's going to really help your children and families thrive, you're building over this time that the rescue plan money is being spent over the next few years, building that alignment and that larger advocacy voice to sustain the kinds of things that the rescue plan has paid for, that would, you could make the case for sustaining them beyond that. Structural changes, you have 5 years for proof of concept. So if you change some things, you've got 5 years to kind of show the difference it makes, and then that becomes part of your advocacy. Pay for success might be something to think about. In another state I'm working in, we're looking at outcome rate cards and trying to see if there's a way to kind of come up with a set of outcomes and get private investors to put in money, and then the rescue plan money would reimburse them down the road. So that's a complex idea, but it's a possibility with the rescue plan funds. New knowledge gained from working across sectors could draw down more funds as you align resources, because you know each other's systems and you have shared outcomes that you're trying to reach, so you can braid money, ongoing sources of money more effectively. Practice changes. So if you make systems more trauma informed and healing centered, do you get more efficient in your systems at addressing needs further upstream, so that those deeper, more costly interventions, maybe fewer of them are needed because you've helped people avoid escalating into deeper and deeper levels of need. And then there's possible federal changes on the horizon. So for example, if the child tax credit gets extended, then those families will be receiving that going forward, which makes a huge difference for their financial situation. There's the potential that Congress is going to ask the federal Medicaid authority to look into how can Medicaid be used to prevent or address adverse childhood experiences. So that could be a new source of federal funding in the future. So there are lots of different ways that gains made with American Rescue Plan money could be sustained, but that everybody's not necessarily thinking about that. So for you all to think through that and bring those ideas forward is important. Offer leadership for alignment. So factor in long-term sustainability. So for whatever you propose, think about how you're going to evaluate and prove that it worked and saved money or allowed for redirecting funds. Create a results action plan for system of child and family well-being. We've already talked quite a bit about that. Forge and deepen cross systems partnerships. So giving leadership to that, to really think again holistically about families' need. Shift the systems culture, and there's some work I could I'm doing in other places that I could share with you. This is a relatively inexpensive item that local communities can do to really help them make culture visible and start changing things that just make the work stronger overall. And then build leadership skills from a shared model. So my recommendations are results-based accountability, results-based facilitation model, to really have a model that you're actually using to move from talk to action, to move big ideas forward and get everybody trained in that and everybody aligned to a comprehensive plan. And you just become a much more efficient and effective group of community leaders. So I'm going to move us to, I'm looking at the time, we're going to go give you about 5 to 7 minutes to just kind of get in small groups and absorb this a little bit. My request is that you come back, you have a reporter who comes back with at least one question to post in the chat, and that whoever you identify as that reporter to jot down as much of the conversation, as much of the kinds of questions folks have, and prepare to share that with us via email to probably to Lydia. We'll work that out while you guys are in your Zoom rooms. But basically the questions are kind of, what do you already know about the use of rescue plan funds in your community? Do you see windows of opportunity? What questions do you have? So just giving you a minute to kind of be with your colleagues and say, gosh, we just heard a lot of information. What are the kinds of things that are bubbling up for us that you want us to know so we can be thinking about it before we're hopefully with you again. Hopefully you'll join us in a couple of weeks. So Lydia, are you ready to break them into small groups for just a little bit of processing?
Yeah. So I also put the questions into the chat. So if you need to look back at the questions, they should show up for you there. Okay, so I think we'll open these rooms up. Enough time. It's never enough time in breakout rooms. That was just a taste of, I think, a further discussion that we will be continuing in our learning exchange session that we hope that you can all join us for in a few weeks. And so let us come back, and if we want to have, I'll let Marlo kind of frame our continued discussion.
Yeah, what I'd like to ask is if whoever got identified in your breakout room as the reporter and recorder, if that person would just go ahead and chat the question that your group came up with. And as I said earlier, if your group came up with a lot of questions, we'd love to have those. And I don't know, Lydia, does it make sense for them to email those to you? Or do you want to do that a different way?
Sure, that would be great, actually, for me to be able to capture it, since I will be part of the next session. I will put my email in the chat, and please take it down if you have stuff that you want to send to me.
Thank you, Lydia. So we'll sort of watch for questions to come in now, and maybe we can answer a couple. But like Lydia said, hopefully that just gave you a minute to take a deep breath and process a little bit with your colleagues about what you heard, but knowing that that we can have a lot more of this kind of conversation at the learning exchange. And I'll just share some of the comments that came through as I was presenting, just while we're waiting to see some of the other questions come in, just very quickly. Some of you may have contacted a level of government that says the funds are already obligated. And what I would say to that, the counties got their money the earliest. And so they may have already made those decisions. I think it's still worth it for you to be in touch with them, to learn what those decisions are, and to bring a child and family lens. So if you know that they've allotted money for something and they need to know how that something is going to affect children and families one way or another, you may still need to be a partner with them, even if it doesn't mean money for you. So that's one thing to think about. Another is that sometimes they're allotting money in kind of categories. And if there's a category they put money in, the question would be, how detailed is their plan? Or is there still a possibility of partnering with them on their plan and maybe even being receiving some of the money in that way? I think those are the two things that I wanted to be sure to say. Oh, I know that the other thing I will just say, we talked a lot about having a framework and for a system of child and family well-being. And I hope what has come through is that the idea is make this framework now as part of trying, at least giving a good try at getting a rescue plan money, and hopefully you'll be successful. But even if not, the framework it's a good time to do that anyway, because other resources will flow, and this is sort of, the rescue plan sort of gives that opportunity to think differently, that's not always there. So I saw some of the questions are getting answered about having the recording available, and yeah, I hope that having the recording available helps you go share it with others in your community or in your organization, especially if they are folks that would maybe be good candidates to join the learning exchange in the next couple of weeks. You want them to hear this to kind of prime their thinking. Lydia, do you see any other question I might be able to answer quickly that are about?
I think a lot of the questions were around like how to advocate. I think that you kind of answered that already, but I think that might be a question for some deeper discussion in our learning exchange session, because I think there are probably many different strategies that can be used. And I think in order for, I think, Marlo to have time to, have a thoughtful answer about that, and as well as our team to really gather some more information, I think that would be a great way to open up the discussion for our next session. I think there are some questions around regionally, how to get creative with the funds, how to identify partners. So I'm not sure if that's a quick answer or perhaps another topic for us to cover next time.
It's probably another topic. Yeah, I think we'll need to dig into that. But thank you all for sharing questions, because that will help us. And if other additional questions came up in the group, and if your recorder agreed to email them to Lydia on behalf of your group, great. And if you didn't get that far, but you have questions you want to send to Lydia, we welcome those. So you want to go to the next, actually the next couple, the next slide, and then the next one. So we just want to, if you'll back up one or two.
I'll just mention really quickly, I know we're at time right now, and I want to be mindful of everybody's time. So
yes, yeah, exactly. I'm seeing that. So if before you sign off, if you would briefly just chat to us one next step you're going to take based on what you learned today. It can be a phrase, 2 or 3 words, a statement, but if you would share that with us, that's going to also help us prepare to support you going forward. And while you're doing that, I will just say my contact information is on the slide. That's the next slide. Some of the resources I either referenced or that I use right now that I find to be really helpful resources, just generally, I have put on the very final slide in the deck. So when you have the deck, you'll have access to some links that I myself have been drawing from that I think might be useful to you. So so I'm hoping to see your commitment to next steps in one way or another in the chat. And I will turn it back over, I think, to either whichever, Michael, Sarah, or Lydia, whoever wants to say the closing comments, but just to say thank you all very much for having me. I hope this gave you a lot to think about, and I look forward to being with you in a couple of weeks where we can be a little more conversational and interactive and dig into your questions more deeply. So thank you very much.
Thank you. And we will make the PowerPoint available. So as a follow-up, we will go ahead and send that to everyone, as well as some of our flyers that we shared in the chat. I know sometimes it can be difficult to download. Just another reminder that to please join us to continue this conversation on Wednesday, October 27th from 11 to noon. So we will have some time to do that as well. And also just to keep in mind, we have a couple of amazing webinars coming up to include in this series. One is Funding to Reduce Homelessness with Althea Linus Fernandez from the Department of, or California, sorry, this is incorrect, California Department of Social Services, and Elena Fiallo, who will be joining us from Pop Change. She was here today, actually, so if you had Elena in your group, you got a chance to meet her. Also, the Associated Learning Exchange session for that will be November 11th from 11 to 12. We'll also have one for community schools funding opportunities with the United Way with Jose Vargas and Janice Connellan. And that learning exchange session will be December 7th. So lots of really amazing stuff coming up. The flyers are again in the chat, but we will email those to you as well as a follow-up. And we want to stay connected with you. So please follow us on Facebook, LinkedIn, and YouTube. And as well, please sign up for our newsletter so you're always informed of the wonderful work we're doing, as well as the events that we have. We have lots of stuff coming up for this new year. So again, thank you to Marlo for sharing her expertise and her time with us this afternoon. Hopefully you were able to understand more about the ARPA funding and how you can potentially engage with that in your community. And I'm not sure if Michael or Sarah have any closing thoughts. All right.
Thank you all for joining us. Nice to see you.
Thank you. Great information.
So we appreciate all of the wonderful, amazing work you're doing for children and families. And we wish you a very wonderful afternoon. So take care, everyone.